we should be expecting future variants to also appear, meaning that we are going to be looking at a situation where we have to be better prepared in future, particularly with our vaccines and our arsenal of vaccinations, to ensure that we continue to have good protection against hospitalization and deaths. And so far, we do see that the vaccines are holding up in terms of ensuring reduction of deaths overall, but we do see that hospitalization figure creeping up.
Yeah. Does it mean that the subvariants are just getting better at escaping the vaccines or overcoming the vaccines?
Unfortunately, evolution continues to outpace our ability to gain protection. So this is why there's also been a lot of discussion to try and develop a universal coronavirus vaccine so that it could protect not only against the current circulating strains, which is BA4, BA5. Some pharmaceutical companies have already started early clinical trials with BA1, BA2 subvariants, which are closely related. But in future, it would be even more efficient if we could have this universal coronavirus vaccine that protects against future variants as well.
How difficult is it going to be to develop that sort of vaccine?
Well, there are very few vaccines in the world that are able to completely prevent transmission. We do see smallpox vaccine was able to eradicate smallpox, but on the whole, we shouldn't be looking at vaccines as a cure, but more of a preventative tool that can help reduce severity of symptoms. So the goal, I would say, has shifted. It's no longer about achieving this herd immunity concept because, the pace of these variants is just too quick. But we should be looking at tweaking the existing vaccine. So we are in a much better position now to have a Omicron-specific variant vaccine because of the existing work done on the COVID vaccines with that mRNA technology. However, a type of vaccine that has protection against, universal, all future coronaviruses, that's a little trickier. That will take longer to develop. But it does look as though as early as this fall, we could have a Omicron-specific vaccine.
Mm. What is also interesting is that for some people, COVID triggers quite a severe reaction and then also repeated infections. What is that telling us about the virus?
Absolutely. In the early days, there's quite a lot of scientific debate around whether there'd be even the capacity for reinfection. And now we see that people are perhaps on their third time of catching COVID. In general, we can see that in healthy, younger population, it tends to get milder with each case of reinfection, but that's not in all cases. And we can see, particularly those with comorbidities, complex cases, that there can be cumulative damage upon reinfection in some patients as well. So even if we have had COVID previously, that doesn't make us immune to future infections. In some cases, it can be milder, but in others, we do see complications arise, not just long COVID. Now, the interesting aspect with long COVID is that yes, the most severe long COVID symptoms are tied to cases where people may have been hospitalized or they've had very severe symptoms, but that's not the full story. Those that have had mild symptoms, fully recovered, then have these persisting symptoms, chronic fatigue, actually quite a variety of different types of symptoms. And that can be broken up in almost three categories. So we have first of all, the cellular damage. We know that COVID is a multi-organ, affects many organs. It's a multi-organ disease in some sense. So you have that direct cellular damage, and you can have long COVID as a result of that with breathing, etc., the damage to the lungs. Or you have complications arising from hospitalization, particularly they've been in ICU, there's some post-traumatic stress there, or in the cases where, and this is the most puzzling, the mild COVID, followed by recovery, and then in that ongoing period, other symptoms arise. And we just don't have full answers as to how long that will continue.
Yeah. Yet at the same time, Oksana, you know, as you know, in Europe, people are wanting to approach this as if it's just diminishing, not increasing, even as the second wave has hit this, where are we, our fourth or fifth wave at this point. You know, people don't want to go back to always wearing masks, social distancing again, but that seems to be the message that some health professionals are coming back to.
I'd say in different countries, we see different levels of communication and different strategies in place. Certainly, we see almost in some regions, it's just dropped off. There's no instruction. And we do know that actually when there is a clear rationale provided, people will act accordingly. But there are systemic big interventions that could be taken that don't disrupt our lives, that actually we wouldn't even notice. And Bev, we've talked about this many, many times, and very little action has been taken on this in terms of ensuring that public spaces, office buildings, schools have appropriate air filtration systems. It took from a public health perspective, we have built methods to ensure clean water supplies, and that battle actually still continues. But clean air is something that we need to demand more of, would reduce the burden of disease, and actually would have very little disruption to our lives, and we can carry on. Of course, we are in a different position than we were before the vaccines were available, and there isn't the need for the same level of stringent reactions, but we need to be actually monitoring and basic surveillance, allowing testing such as the lateral flow test to be free of charge. All of these things are small steps that actually have a big impact. So we need to keep that surveillance up. We need to make sure that testing is available, and there need to be better overall systems for air filtration in communal buildings, and some advice of what to do if you do catch it now, either for the second or third time, or perhaps your first.
Yeah. Oksana, good advice as always and analysis. Thank you so much.
Thank you.